welcome to another episode of Saves9 Podcast, where we bring you insightful conversations with experts who are trying to make difference in their fields. Today we're going to dive into a fascinating world of hormones, and we're going to talk a lot more about the hormonal imbalances and pediatric endocrinology and everything. So we are honored to have with us Dr. Bhakti Katariya, who is an esteemed pediatric endocrinologist, and she has dedicated her career in helping children overcome the complex hormonal, growth-related and endocrinal-related disorders. So in this episode, we are going to more focus on the key roles of hormones and how important they are in our growth and development of our children. So we welcome Dr. Bhakti Katariya to our episode here. And first, I want to know that what inspired you to take this interesting field of endocrinology after your MBBS?
So after my MBBS, I pursued my MD in general pediatrics. During my training, I had seen quite a few patients of hormonal disorders like type 1 diabetes, thyroid disorders like hypothyroidism or hyperthyroidism. And I was very fascinated to see the hormonal interplays having such a profound impact on their growth and development. And also on reading further, I got to know that the endocrine does not only concentrate on a single organ system of the body. However, it has an impact on the entire body.
Right.
Hence, I went ahead to do my degree in pediatric endocrinology from Jarabai Wadia Hospital, which is in Mumbai.
Wow, that's really great. And I know how much efforts it takes to become MD and then super specialize into this particular field. I'm very happy. And so what a typical day of a pediatric endocrinologist looks like?
So my entire day I spend mostly looking at the OPD patients, followed by references and ICU, which are from the ICUs like NICUs or IPCUs, and sometimes even from the casualty. So in OPD, I mostly see disorders of growth hormone like short stature patients or thyroid dysfunctions, either hypothyroidism or hyperthyroidism, type 1 diabetics which do come in our OPD, which are very frequent. There are other bone and calcium related disorders of sexual development. All of these are the OPD patients who frequently come to us for the follow-up. After that, there are few references which I do get from ICUs for persistent hypoglycemias which are seen in neonates, and also the sick euthyroidism patients which I do get from IPCUs. And sometimes I do get casualty calls also when patients come to us with diabetic ketoacidosis and congenital adrenal hyperplasia patients. And I love to spend most of my time counseling the patients regarding their disorder and about the treatment options.
Great. So, according to you, what are the most common endocrine problems, disorders you face, like children face these days?
So, endocrine branch, it is an emerging branch. And we do get a lot of patients with the hormonal imbalances nowadays. So, most frequent patients which I do see in my OPD practice is short stature, which can be due to any cause.
So, can you talk more about it, like what exactly it is?
So short stature basically is a stunted growth. So the stature or the height of the child depends on the genetic potential, that is the height of his mother and father.
Okay.
Other than that, it also depends on the nutrition what the child takes, whether the child has any chronic systemic illness or not.
Okay.
So, and there are some syndromes also in which genetically, like inborn, the child is short and will remain short forever. So these are some of the very few causes which are the cause of short stature. And growth hormone deficiency is one of the cause which comes after ruling out all the other causes. So it is very rare. So if any short stature patient comes to us, we have to rule out all the other causes to label it as a growth hormone deficiency patient.
Okay. So how do you diagnose growth hormone deficiency?
So it depends on the history, clinical evaluation, anthropometrical evaluation, and then the investigations. Okay. So in history, the child may have severe persistent hypoglycemia or any prolonged icterus in infancy.
Okay,
icterus
means
icterus is jaundice. Yes,
right.
jaundice. And second is that on clinical evaluation, the child will be severely short they may have a growth hormone deficiency kind of facies. That is, the forehead is prolonged, a saddle nose, the voice will be a high-pitched kind of voice. They have a baby or a small child-like facies even after growing up. And they do have dental abnormalities as well because of maxillary hypoplasia. There is crowding of the teeth. These are the few subtle signs of growth hormone deficiencies. If as an endocrinologist all of these signs are seen, we go ahead with the investigation. So first and the most common investigation we do is a bone age. So what is bone age? Bone age is basically we do a X-ray of a left hand and we calculate the bone age. So bone age, normally the bone age, the chronological age and the height age, they all should be equal. However, yes, they all should match. However, in the growth hormone deficiency patient, the bone age is severely less as compared to the bone. And second is we should do other hormonal evaluations as well, because you know the growth hormone is secreted from the pituitary gland. In the pituitary gland, which is in the brain, there are other hormones which is secreted from that. So with growth hormone there is thyroid hormone, then there is ADH which controls our urine output. Then third is our sex steroids like FSH, LH. Also there are many other tests like IGF-1. We also do MRI brain to know the size of the pituitary gland, whether there is pituitary hypoplasia or not. And then for treating it, finally we start the patients on growth hormone injections, which has to be given daily until the final height or the expected height is achieved.
So next you talked about type 1 diabetes in child. So how do we diagnose it? What are the early signs we can look out for, and can you tell me more about it?
So type 1 diabetes, there are few signs and symptoms which the parent and as a doctor we should see in the child. So first is child may have excessive thirst, polyuria, that is the child may go to pass urine every now and then. He may even have a nighttime bedwetting. Second is that the appetite is severely increased. However, the weight of the child is still not gaining. In fact, the child is losing the weight. And sometimes there can be even ant around the urine which the child has passed. These are the few signs and symptoms we have to look for the patient which may have type 1 diabetes.
And generally around what age should we, is there any age criteria for that?
So there is no age criteria as such. We have even seen diabetes diagnosed in infancy and like even at 16-17 years of age group also child may have type 1 diabetes and sometimes even later.
So nowadays, Bhakti, I see that a lot of children are overweight at very young age. So does endocrine has any system, any role to play in it?
So you're correct, Rucha. So nowadays obesity is a rising concern. And the most common cause of obesity is exogenous cause. So exogenous means what? It's a nutritional issue. Yes, you're correct that endocrine, there are few endocrine causes of obesity as well, but the most common cause is the nutritional cause. So there are nowadays the children are indulging a lot in having junk foods. You know, their screen time, there were a lot of the screen time has also increased a lot. The physical activity, they don't do a lot of physical activity. It is mostly the video games, so they spend their time mostly sitting at home and just playing around in the house itself. So this is the most common cause of exogenous obesity, that is the nutritional cause of obesity in children. Other than this, there are few endocrine causes of obesity as well, like there are some syndromes in which the child get obese, but those are very rare. So it's the nutritional cause.
It's only the lifestyle factors which we have to improve. Alright, great. So how do we do you have any idea on how do we control screen time of children?
There are IAP guidelines for screen time, the age related guidelines for screen time. So how much the child should be exposed to screen in the infancy, in 1 to 5 age group, etc. So everyone should follow that screen time along with their parents. And at least 60 minutes a day the child should get physical activity has to be done, outdoor activity. 5 days a week is also okay. So all of these, if everyone practices, I think obesity, the obesity monster, we can fight with it.
Great. That's a really nice term, obesity monster, and we have to actually fight with it, because when we were young, there were like no mobiles and everything, and we used to like go out and play every time. But nowadays,
True.
like because of access to all the social media and digital platform, child is much more engaged in screen time. So parents, we should take care about this thing, like reduce screen time and increase the outdoor play activities and control on your nutrition. So Adar, you also spoke about thyroid problems in children. So can you shed some light on it?
So thyroid is a butterfly shaped gland which is present over the neck. So there can be either hypothyroidism, that is thyroid hormone deficiency, or either hyperthyroidism, that is there is excess of the thyroid hormone. So hypothyroidism is much more common than the hyperthyroidism.
Okay.
So nowadays, because of increase in awareness of thyroid and incidence of thyroid imbalances, they are getting diagnosed more frequently.
Okay.
So there is something known as congenital hypothyroidism, that is the child has hormonal deficiency since the birth.
Okay.
So the causes can be various. It can be either the thyroid gland is absent, or if the thyroid gland is present, it is not functional, or the enzymes required in synthesis of thyroid hormone is not available. There can be various causes.
Okay.
So there are few subtle symptoms which we can look to know whether there is hypothyroidism or not in this child.
Right.
First is that the child may not grow very well. The height of the child is very short.
Okay.
The child is fat. Like the fat and the short child, we should first think about hypothyroidism,
Achha, fat
or
and
the
short.
endocrine causes. So any endocrine cause, the child may be fat and short. So that gives us the clue that child may have some endocrine problem.
Yeah.
Second is that he may have constipation, a lot of constipation.
Okay.
And if it is a severe hypothyroidism, there can be edema, or generalized edema can also be there. He can have a icterus, a visible yellowish tinge on the body can be there. These are some of the symptoms. Thyroid hormone is very important for intelligence, for development of brain as well. So sometimes the child may not be very good in the studies. So these are some of the subtle signs and symptoms we have to look to rule out hypothyroidism.
Great. So we spoke about overweight and short height, but does low weight gain has anything to do with this?
So mostly in endocrine, if we think about endocrine, it is always the short stature with obesity.
Okay.
If we are thinking that the child is short and he's low weight, then it may be some other cause than endocrine. It can be a nutritional cause, or maybe a chronic systemic illness. All of those causes can give rise to a low weight with a low height.
I see there is early onset of puberty or a delayed onset of puberty. So does endocrine has a role in it?
Yes, Rucha. So pubertal abnormalities, there are two kinds. Either there can be a very early onset of puberty, which in our language is known as precocious puberty.
Okay.
And the second is delayed onset of puberty. So what is basically puberty? Puberty is what the onset of secondary sexual characters which is to be seen. So normally the age group differs in girls and boys. So in girls, what are the pubertal signs? So it's like onset of breast development, axillary hair and pubic hair. In boys, it's the penile enlargement, again axillary pubic hairs along with testicular enlargement. So onset of puberty before 8 years in girls and before 9 years in boys is known as precocious puberty.
Okay.
So anything before 8 years or the breast enlargement before 8 years has to be diagnosed, has to be evaluated and has to be treated.
Okay.
So in evaluation, we do some of the hormonal evaluation so as to know whether the cause is central or the peripheral. And the treatment, if needed, has to be given. We have GnRH analogs to delay the puberty if it's very early.
As a parents, like what lifestyle modifications or what dietary changes should we do in order to prevent such hormonal imbalances in our children?
So there are few diet habits, you can say, which can lead to precocious puberty, which is not very dangerous and very harmful but has to be prevented. So the excessive intake of soya bean or even excessive intake of packed meat which is injected with estrogen to keep it fresh, has to be avoided, because this can lead to precocious puberty.
Suppose any of the child is diagnosed with any endocrinal disorder, so does diet or lifestyle modification has a role to play?
Yeah, so it's actually very, it can be even specific to specific disorders as well, like in hypothyroidism. So, you know, iodine is a very important for synthesis of thyroid hormone. So, an iodine is mostly seen in the soil, but because of soil erosion, most of the iodine is lost. And there are salt which has iodine in it. So, government adds iodine in the salt so as no one gets iodine deficiency and hypothyroidism. But you know, some people use rock salt. So, rock salt is something which has iodine. The Tata Namak or most of the brands, they do have iodine in it. So one should always use the iodized salt in the diet, because it has to be used daily.
Okay.
Second thing is that, as I said, in precocious puberty, one should avoid all of these food stuffs. For obesity, even for the healthy child, everyone should eat a healthy homemade food and avoid all the junk fried food.
What role does genetic factors play in endocrine imbalances or disorders?
So genetic factors play a very important role in endocrine factors. However, it's a last step after ruling out everything, after doing all the other investigations. If we still are clueless, but still we have a clue, maybe a syndrome, like a appearance of the child. If it gives us the idea of some typical kind of syndrome, then we can go ahead doing a genetic test.
So that is at a very later stage.
And also, the genetic tests are very, very costly. Not everyone can afford this test.
Okay.
So it is the last step, at least in India. But outside India, in some foreign countries, it's easily available. It's covered under the insurance as well, and it's less costly.
Okay.
Maybe after few years in India also, we routinely can do some genetic tests.
That would be nice,
Yeah.
like if it happens early. So, any interesting or groundbreaking research in your field that excite you?
Yeah, so there are many researches going on nowadays in the field of in the branch of type 1 diabetes mellitus, because it's a very it's very difficult to manage these patients. I feel very bad seeing these patients, because they have to take injections every day, almost 3 to 4 times a day. After every meal they have to get pricks. So researches are going on in the field of they are trying pancreatic transplants in this patient. However, it is not approved yet, but I'm looking forward for this. If it gets approved after a few years, it will be a very good for our patients.
Yeah, because I can really imagine, because pricking kids every now and then is a very difficult task. I can imagine that.
And other than this, now we are using growth hormone injections for increasing the height. But before the year of before 2000, just 24 years back, it was very it was not available that easily, and it was very, very costly. The synthetic hormone, which is very safe nowadays, it's available now. So we can just see that within just a span of 24 years, it has become so common, and many children, they're not confident because of their height. And if the cause is growth hormone deficiency, why not to go ahead and give growth hormone injection?
Right.
So I would like to tell all the parents and advise them that they should look for all the signs and symptoms which I have mentioned, for all the disorders which are nowadays very common in children, like obesity, short stature, thyroid dysfunction, pubertal problems and diabetes, and consult the pediatric endocrinologist at the earliest, because these have become very common. They can be managed and they can be treated completely.
Great, Dr. Bhakti, that I'm very happy that you came here and spoke about all the endocrine problems and hormonal imbalances. A lot of parents don't know about all these things, and like diabetes and thyroid, we always consider that after age of 40 or 50 ये सब diseases होते हैं, बच्चों को ये सब नहीं होता है. So nowadays, because of our lifestyle factors, all these lifestyle disorders and diseases have come
and it's more important in children because it is affecting their growth and development.
Yes. So thank you so much for showing us light on this.